All right. Well, thank you so much for joining us here on Fraud in America. Today, we are joined by the Anti Fraud Coalition's Whistleblower of the Year, actually, Dr. Rayme Edler. Thank you so much for joining us, Dr. Edler.
Thank you for having me.
So unfortunately, you were not able to join us in person to receive your award at the recent Anti-Fraud Coalition annual conference due to the hurricanes that were coming through the southern United States. Did you come out of everything okay? Was there any damage to your property or your family and everything was okay?
Everybody did very well. Fortunately, we were in the side that didn't get hit too hard, so we were good.
Well, that's really good to hear. Unfortunately, you missed the standing ovation that occurred in the room for you. There was a little bit about your story there on the program for the annual conference, but luckily we get to speak with you here and hear more about your story today. So thanks again for joining us. And we're also joined by Darth Newman, who was one of her attorneys in the case. So he'll tell us a little bit about the attorney side of the case. And Dr. Edler will talk about her experience going through this case as the whistleblower. And before we get into the details, though, of your case and the fraud and kind of what you experienced as a result of your whistleblowing, we'd love to hear just kind of a little bit more about your background, your childhood, and kind of how your life before you became a whistleblower.
So let's see. If I go back, let's not go back too far, but if I go back to when I decided, we can go all the way back. I can say that I knew I always wanted to be a doctor growing up. I was always drawn to wanting to help people. And so when people would ask me from I remember, it was like 5 and up, my family will say is that I always said I wanted to be a doctor. Didn't know exactly what field of medicine I wanted to go into, but knew that that was probably going to be my calling. As I got older and I was in college, one of my lab partners ended up being, he was in the military and he would tell me about all these war stories about what it was like to be a paramedic. And I was like, oh, that sounds really cool. Let me see if I can get into that and see if I really want to go the medical route. So I ended up deferring my scholarship in college for over a year. It was a little over a year. And I had become an EMT over a summer and then deferred the scholarship to do the paramedic curriculum and work for New Orleans Health Department while I was finishing up my undergrad in biology over at University of New Orleans. So I did some work at Charity Hospital with the medical director of what we call the major emergency room over there, doing clinical trials as well as working as a paramedic. And then I decided that I wanted to go to medical school. So that's kind of how I advanced up to where I am now.
And was there anything in particular that, you said you always kind of wanted to be a doctor, but is there anything that kind of inspired you to go that direction?
It always came very natural to me. So I can flash back and I can remember a time that I was with my stepfather back in New Orleans and it was Mardi Gras parade and I was very little and this man got pulled off a Mardi Gras float and everybody started to scream and run and I wanted to go straight to him and I was very young, like I was in elementary school and that was always something that came to me. And when I went through medical school and I got to go through the different curriculums, like with, let's say, OBGYN and different fields of medicine, I was always just drawn to knowing a little bit about everything and being there in the sense of an emergency. So I think it was just my field, my calling. Like some people will say, like your internal medicine doctors are your sprinters, and I'm sorry, are your marathon runners, and we are the sprinters. And so that's how my mind seems to operate. I like to kind of go a little bit faster than everybody else, and then where I can have more time to kind of move along.
Yeah, it makes a lot of sense. It's not boring, that's for sure, right?
No, that's probably the other part of it is I've always been more of like the adrenaline junkie. I think it just comes with the nature.
And speaking of non-boring lines of work, Darth, how did you kind of get into representing whistleblowers like Dr. Edler here and kind of doing this kind of work?
Well, I'm married to a doctor. I can say with some authority that my line of work is substantially more boring than Dr. Edler's or my wife's line of work. Um, I I think ever since I was a kid, always wanted to chase bad guys, like playing cops and robbers in the playground as like a 5-year-old or whatever, all through law school, through everything. And this lets us do that. We we get to represent the interests of the United States, and depending what state you're in, sometimes the various states, along with our clients' actual interests, which are often pretty perfectly aligned to recover misspent and ill-gotten taxpayer money. Um, I Because of the nature of the case, I don't think I have a single one on my docket where I don't think that the other side like did a bad thing, and usually with some substantial intent. Like we're not going after people who make mistakes. We're going after people who are are taking things that aren't theirs, and often, especially in the medical context, um, patients end up paying for it, even without knowing why they're getting the bad outcomes. It's because somebody somewhere in an office somewhere made a money decision, and now you're suffering medically, and that just upsets me.
And that is what happened here. Dr. Edler, do you want to talk a little bit about, you began working in the emergency room in Escambia County, and you started noticing EMS is delivering patients that are, have injuries that are unexplained. They're, suffering traumas that they shouldn't be. Can you kind of start talking about what you started seeing in the ER there?
Yes, it was the quality of care that was diminished. So I would say when I would see certain cases that would come in, my question was really about where the training was, and I can relate because of me being an EMT and a paramedic in the past. I know that when you go through that curriculum, you're learning a lot of information in a very short period of time. So I was always the one that was very willing and open to kind of get an idea of why that person, that medic or EMT, thought the way they did and wanted to progress forward with the line of care that they did, because you can learn from it. I mean, every case is definitely going to also be something you learn from. So I started, but there were quite a few things that were coming in. And when I started to question some of the care, I actually would write back to the former medical director or supervisors, and especially with the supervisor more so, I would get some kickback, and I thought that was a little bit unusual. And then it excuse me, then it came into the case where one of the nurses that I had worked with for a period of time, her son was involved in an accident, and that accident led to his death as well as the death of his best man, because they were at their bachelor party. It was on a Wednesday before the Saturday he was supposed to be married, and he was hit by a car. And the person who hit them had videoed the entire incident that happened, with them being on the street and the line of care that proceeded or followed from when the medics got there. And I was just taken aback at the lack of urgency. There were very basic things that should have been done that were not done in this video, and I was very surprised by this. And so I think the nurse, well, I know that the nurse whose son is involved, she was as well, and she wanted confirmation. So that's why she came to me and she asked me to watch the video. And I was lost for words. And so that's when she made me aware that she was going to be taking it to the county administrator's office to be able to speak with her county commissioner. And she'd asked if I would go with her. And that's pretty much where everything started.
And that isn't the only case where there are actually deaths that occurred because of mismanagement of patients that were coming into the ER, right?
No, there were other ones that were definitely brought to awareness. For instance, if there was one patient who's he wasn't properly intubated. So when we take a tube and we put it in the airway to breathe for you, it needs to go into the lungs. But it's where the trachea is and where the esophagus are. They're both in close proximity, so it can be a common error to take the tube and put it in the esophagus instead of the trachea. But that's a very critical situation, and you have to be able to recognize that you're not ventilating the patient if you're putting air in their stomach and not into their lungs. And if that happens, then the patient becomes brain dead. And there were cases where this had happened, and the patients were ended up being organ donors, even though they were resuscitated. They were brain dead. So there are cases that were like that. They had cases of wrong medications, wrong dosages that were being done. So yeah, there was quite a few things that were happening.
Yeah. And so was it immediately kind of it occurred to you that this was a problem with the EMS service, or the training with the service, or what did you do kind of um, to try to figure out what was going on there?
Well, so when I saw the things happening just throughout the emergency department, and when we met, I think it was the second time that we had met with the county administrator. I brought some of my concerns that go beyond just what had happened with Dawn's son. That was the nurse that I was referring to. But I brought those some more concerns up with medication dosages and a few other things. And that's when they made me aware that they were going to be looking for a new medical director. And they said they were going to be hiring and that I should really consider because they wanted somebody, and I quote, they wanted somebody who had good ethics and morals and somebody who had a passion for emergency medicine like I was portraying to them. So after long thought, discussion with my family who really encouraged me or tried to encourage me not to take the job. I did it because I thought it was a calling. And it wasn't until that I got into the public safety building and started meeting all the different individual players that there were some people that started to trust me and they started to make me aware that there were some things going on. And then I was also aware of some of the shadiness with some of the individuals that were in the administration portion of the public safety department. Um, so that's kind of how it got started. And that's when I started to ask more questions. And when it was brought to my attention by another employee that was there that was very afraid to come forward and bring any information to just anybody. And she said many people were trying to bring awareness to what was going on because a lot of people would be retaliated against, they would lose their jobs. And so that's what their biggest fear was losing their job. So when I was made aware that cards were being handed out for advanced cardiac life support, that's when I started to do my own investigation into some of the files, which proved to be legitimate.
So what was going on? Basically, you started once you were in kind of internal in the EMS. You realized that there was a big problem here. What was the problem?
So there were people who were being handed ACLS advanced cardiac life support cards or pediatric advanced life support cards without taking the proper curriculum. So there were also people who were given instructor credentials, meaning they could teach these courses, who really hadn't taken the proper courses and didn't have the right credentials. For instance, there was one individual who claimed to be an instructor, and when they were presented with a cardiac rhythm, they were not able to identify the rhythm. And not only were they not able to identify it, once we established what the rhythm was, they gave a complete opposite medication of what would help the patient and more or less would have killed the patient. So that's when I knew, I was like, this is a bigger problem than what I thought. So how many people who are out on the street, especially this one individual who was driving around in an SUV that's marked emergency medical services with her own drug box and her cardiac monitors, how many other people can just show up at your door and think that they can push these medications, or are you expecting them to be there to be able to help you, but they have no idea what they're doing? And that's when I had to take it a little bit further.
And can you explain a little bit more about what they should be trained to do exactly to get these kind of cards that say they're able to perform the services?
Well, you go through curriculum. So, like advanced cardiac life support, you're going to go and renew this every 2 years. But it's always medicine's ever changing. So you're going to have to know what medications you're supposed to push. If somebody has a cardiac arrhythmia, such as ventricular tachycardia, what you learn as a medic, and even when you go through medical school, it's like a protocol, or protocols are written by the physician, but you can also follow what ACLS guidelines are, and those get incorporated into the protocols. So if you had ventricular tachycardia, you have to know when's the appropriate time to push a medication, or versus doing like a synchronized cardioversion, you have to know when to do synchronized versus unsynchronized cardioversion. If you have a slower rhythm or like a heart block, you have to know what medications to give or whether or not you should be pacing a patient. You have to learn how to do the proper techniques if the patient stops breathing on you. How do you get a definitive airway, such as establishing endotracheal intubation. So there's quite a bit. And then with pediatrics and pediatric life support, these are little people, but very different as far as how dosages and medications are given.
You said a lot of words there, like ventricular tachycardia, that I don't understand at all, which I think is the point, right? Like these people should be trained to know what to do in these situations, and basically what you're saying is they weren't getting that training.
Correct. Correct. These are all like fast heart rhythms, I guess, slow heart rhythms. And then what if your heart stops? Do we know
Right.
exactly what you're supposed to do? So that's the best way to put it in layman's terms. And it does. It comes with a lot of knowledge and a lot of experience. And when we go through this, and I can vividly remember doing this as my first time as a paramedic, is what we called mega code. So you get brought into a room and they're going to put up a cardiac monitor with a mannequin, and they're going to run you through some of the worst case scenarios, like where patients complaining of chest pain and the next thing you know their heart's going too slow, so what medication do you give? And then as you're doing this, patient goes unresponsive, you have to make sure, are they breathing, are they not? Then you know whether to go forward with the endotracheal intubation. You start CPR, and then what medications do you give? And they will show every different rhythm that you could possibly encounter, whether it's a really fast rhythm, slow rhythm, flat line, and you have to know what medications and what treatment should be going at that exact time. And it's very intimidating, and it takes a lot of practice, a lot of skill, and it comes with a lot of knowledge to really understand what those medications are doing when you're giving them, so you understand what you're actually doing in the field.
Yeah, and beyond that, just any kind of work that an EMT is doing, trying to get people to the hospital, I'm sure takes training beyond just getting the cards and things like that. And basically, none of that was taking place, right?
Correct. So I always say, like, EMS is a great field. It is the special operations of medicine and emergency medicine, because everything that they're doing in a much more difficult environment. They're not in a controlled environment. The best option is to get them in the back of an ambulance, and you might be in the back of a box going 75 miles an hour while you're trying to do everything that I just told you. And that's why we always say, or I like to say, that they're the special ops of emergency medicine.
So once you realized that this was taking place, what was the next thing you did?
So that is when I brought it to the county administrator who had hired me. He had allowed me to have direct reporting with him. So I made him and his assistant aware of what was going on and explained to him that we had a big problem. At that time, I also had recognized that it was the chief of EMS at that time, was part of the problem and not part of a solution. So when I got hired, I was hired with the fire chief. And what the way that I guess the administrative code was written, or no, I'll take that back. It was the Florida statutes. The way they had written medical direction is that I was not allowed to really do anything administrative. And that's where a lot of confusion came into play. So I had all this responsibility, but I had no authority to do anything about it. So it was, here's my medical license, and we're going to use it how we want, but we're going to tell you whether we're going to use it the way you're telling us to use it or not. And that's where it got really tricky. But I got hired at the same exact time that the fire chief was hired, and he was able to have more of that administrative responsibility. So we were working very closely together, and he had worked with EMS agencies in, I think it was Orange County. And so he was able to get a good oversight and see what some of the underlying problems were. And he was the one that was speaking on behalf of a lot of the administrative issues we were seeing.
And so when you were starting to report this up the chain, how did they start to, how were they reacting to your complaints?
So initially, initially we were hoping that things were going to be going in our favor. Again, the county administrator who had hired both of us, unfortunately, he retired early due to some unforeseen family circumstances. And when that happened, that's when things started to spiral downward. So where we were being told that they were listening to us, and we were going to move forward with recognizing what some of the problems were, and we were going to correct them, because we even gave proposals of, here we found a training group that can come in and they can kind of start from ground zero, where they could go and They can look through all these AHA files. AHA standing for the American Heart Association, and that's who distributes the ACLS cards, PAL cards, and so forth, as well as guarantee training over a course of a year. We were able to get that, and we proposed this to the county administration, where even the county attorney said, I can see that this can qualify for an emergent procurement. When I was expressing the concerns, when I said people are suffering, people are dying, this is not safe. My medical license is on the line. But when we made that proposal to the county commission, they didn't want to move forward with that because they thought that there was some other underlying corruption that was taking place with the fire chief, possibly knowing the group that was going to come in and do the training. And so it just got really out of hand. And that's when I had the county commission sign against medical advice forms on a public forum, because I wasn't going to be part of what I knew was very harmful to the public.
Can you explain that a little bit more about that against medical advice forms?
So if you were to come into the hospital and let's say, for instance, I was to recognize you were having a heart attack. And I said, okay, I'm looking at your EKG. Your EKG shows these abnormalities and your cardiac enzymes are indicating you've had damage to your heart. I'm going to recommend that you come into the hospital. You're going to need to do some further testing, get a cardiac catheterization, so forth. A lot of times, and believe it or not, but patients will be like, I don't believe you. Can I go back and feed my dog and then I'll come back? Or they'll want to do so many other things in denial. And you have to really explain to them, no, this is very serious. You've got a problem. You've got a serious health condition. I can't let you leave the hospital, because if something were to happen to you when you leave, then ultimately I could be held accountable as well as the hospital. So if you leave, you're going against medical advice. That's what an AMA form is. So as long as they have the capacity to really understand what those risks and complications could be, and I can say that they do, I can't keep them there against their will. And so that's pretty much what I ended up doing with the county commission after really making this case and proposing it for months and months to county administration and trying to explain to them that people are suffering, people are dying. I was told that I was being very dramatic and so forth. But I was like, well, you know what? This is my medical license that I worked for. The only way I know that I can protect it, when the Florida statutes are written to the way that I would be held accountable if anything were to come back, was to get them to sign against medical advice in a public forum. So I wrote out a document that said, I've informed you of the things that I'm concerned about. And if you delay this training any further and continue to wait, well, then it's on you. It's not going to be on me.
And as happens to many people in your position, you're complaining to the county commissioners, you're complaining to whoever will listen that these trainings need to take place and that patients are suffering and dying in some cases. Not only did they not listen to you, but they started to retaliate against you. Is that right?
Yes.
And what did that look like for you?
So that was the worst part. So it was, I mean, I guess to sum it up, it was pretty much an attempt at a character assassination. But through all of that, it was very trying. So there was one individual in particular, who they call, I guess, or they referred to her as like a political operative, that was just dead set on destroying me. And I mean, to the point of reaching out to people from my past personal lives, to get my child involved, to I mean, she threatened like me, put my home on social media, stating that there were bartenders that were doing, there was a picture of a bartender doing shots between her breast, and they said that it was me. I mean, my whole layout of my home was outlined on a social media forum as they were making these statements that I was lying and that I was trying to get these people in trouble for what reasons, that I just, it was a lot of nonsense, but it put me through a lot of grief, a lot of fear. I started to even question my own self worth at times. It was an awful, awful experience.
And it sounds like it felt also like gender based. So you felt some gender based retaliation and discrimination as well.
Yes, very much so, and that goes back even to the commission, because there was, so I was one of the first female medical directors. They did have an associate medical director that was a female that was there part time through the course of time, but the majority were men. The former medical director before me, who was terminated, they actually hired him again and asked his professional opinion to contradict what I was saying. And I was like, this is a medical director that you terminated, that you told me you terminated based off of negligence that you were concerned about, but yet you're going to hire him to ask for his professional opinion. It just didn't really make a whole lot of sense to me. But then I was told that no other medical directors ever reported to the Department of Health, when that's clearly written in the state statutes that if you do find that there's something that warrants discipline, that you're supposed to report it. And then I found out that there were other medical directors that were in the past that were able to report that, including the EMS chiefs that were able to report it, all of them being men. So I grew up in an environment where I was pretty much the first girl in an all boy family, and I wasn't used to that. It was very difficult for me to really grasp the fact that they were saying this is very gender based, but it started getting pointed out to me more and more by even some of the male colleagues that I work with. So at one point, I did actually file a complaint with the EEOC when the discrimination was, I mean, when the retaliation was getting so bad. And they said that it's definitely obvious that you had this disparate treatment, but they said, but what's going to be really difficult to prove is if it's really truly gender based or if it's whistleblower discrimination. So they couldn't really come forward and take the case on comfortably.
And you also had a young child that you were trying to look out for during this period of time, which must have been really difficult for you.
I did. I did. I mean, there were times that the fear got so great that I would have to tell her, we had code words that I would tell her to, like, if there was something and she heard the code word, that she knew to run to the neighbor's house, because where I was living at the time was on a very public street and an area where everybody kind of knew where my house was. It was a popular area. So I did. There were times that I just was constantly looking over my shoulder because I would listen to these forums that were taking place and was finding out that these people knew of places where I was. And I'm like, they're following me. I mean, it was a very scary time, like to the point where I even ended up getting a dog just to feel comfortable knowing that I'd have a bigger dog to walk me in the neighborhood.
I mean, it's terrifying having a young child myself. I can't imagine going through that. And especially because it's not just a private company that's threatening you. You're being threatened basically through the government, right? This is the county commissioners are enlisting these, other private citizens to basically threaten and harass you.
Yes, and I mean, and at the time, a single mom. So I even when they gave me the county vehicle, they had said I had asked. I said, "Listen," I said, "would it be okay if I drop her off over at school?" They told me that that was fine. So I said, "Okay, I'm dropping her at school," because it was right next to where the office was. And then later on during the retaliation, they came back and said, "No, we never approved that. We didn't say that you could. You're going against policy." And then I had these individuals posting things and reporting to the Department of Health that I was running emergency calls with my 4-year-old in the back of an emergency vehicle. So, I mean, this is how outrageous some of the things we're getting. I'm like, yeah, because I'm going to go run emergency to a car accident. Or I think one of them they said was a plane crash. I was running emergency to a plane crash with my daughter. I was like, that's exactly where I want to take a 4-year-old. So it was just ludicrous. The whole stuff. It was just like, this is not, to the point where some of the complaints, and that's one of the things that this political operative ended up doing, was filing complaints to the Department of Health because she was trying to get me in trouble with the Department of Health and to jeopardize my medical license with these bogus complaints.
And at what point did you decide that it was time to file a whistleblower key tam action?
So, geez, I'm gonna have to kind of refresh back and think of how all this kind of came into play. So when this political operative that I was telling you about was constantly just harassing me and threatening me and making me feel uncomfortable, I and that's when I knew that she'd filed some bogus complaints to the Department of Health. But I was told you need to get a health lawyer involved, and so that is when I initially hired a health attorney to help me with this case, because I knew that my license could be potentially on the line at this point. So now I was coming out of pocket. And that was something else too, is that, even though I had asked the county to help me because this was all job related, they refused to give me any assistance with my legal fees and stuff as far as getting the other health attorneys involved. What he ended up doing proceeding forward was trying to do a cease and desist against this individual person who was able to connect with some other very powerful people and continue to churn attorney fees, is the best way I'll say that. And I knew I couldn't afford it anymore. So I ended up having to drop the case, and I just kept doing research after research because I didn't really know what a key tom case was I filed a whistleblower complaint with the state. And what they ended up telling me was that I needed to, they wouldn't be able to handle county government, and that I needed to go to the county attorney as well as the administration. I'm like, well, so what do you do when it's the county attorney and the administration that's harassing you? So that's when I just kept doing more research, and I found out about the key Tom aspects of what this case could have, and found the attorneys that could help me out to move forward.
And Darth, when did you kind of get involved in the case, and how did that work?
Dr. Adler first got connected with Jonathan Kroner, and Jonathan investigated the case and actually is the one who filed it, and then worked very briefly with the government before the government declined to intervene in the case. It was after the government declined and the case was unsealed, Jonathan called me and asked if I would come into the case then to help him to actually litigate the case against the county, which I was very happy to do. Um, and then we fought with the county. It was like 1 or 2 years, um, and we're making some progress. And then decided to bring in additional lawyers from the Nicholas Castor law firm. And that was Matt Morgan, Rebecca Bailey, Joe Robinson, and Grace Channon. Um, and then that was the final team. That was the team that was going to try the case. That was the team that we were working on closing out discovery. Um, when the county asked, like, hey, can we stop? Can we go to mediation? Can we try and like find a resolution so we don't have to finish? We're basically on the eve of starting like a whole mess of depositions, and they said we don't want to do that.
And can you just talk briefly, in case anybody watching isn't totally familiar with the False Claims Act, kind of just like really basic what the False Claims Act allows you to do and what it means if the government doesn't intervene? Just that kind of thing.
Yeah, I mean, the False Claims Act is the government's most powerful anti-fraud tool and has been for many, many decades. Um, the law, and there's a version of the law in a majority of the states lets you do this for state money, but the federal law essentially says that random person in the country figures out that someone is stealing money from the feds. You can file a lawsuit in secret on behalf of the feds to get that money back, right? If you can identify the lie, you can identify the flow of the money. Um, you have a claim. So you find a lawyer. You have to have a lawyer to bring these cases. You find a whistleblower lawyer. They investigate it. You put the case together. You file it in secret, and then you sort of hand deliver the allegations and all the evidence you've come up with to federal prosecutors. And the federal prosecutors get some period of time to investigate in secret, and that could be, you know, as short as 60 days. It's never that short, or as long as 10 years or something crazy, even longer sometimes. Average is probably a handful of years. And at the end of that investigation, the government makes a choice. They're either going to take the case, meaning they're going to tell the other side, like, we, the government, think that you have done this bad thing, and what are we going to do about it? Oftentimes, defendants will say, yeah, you caught us, let's settle. And then other times they'll fight, and then the government does the fighting and the litigating. And majority of the time, though, the government says, we're not going to do that work. We've investigated, and for policy reasons, resource allocation reasons, or other reasons, we don't want to fight this fight. And the vast majority of the time, they'll turn it back over to us. And so the whistleblower and the whistleblower's lawyers can then go do the fight. The secret part is over, and now it's just in the public, like regular litigation. And then we fight, often for more years, through a normal litigation process.
And that's what happened here. The government declined to intervene. Now it's out in the public. And Dr. Edler, basically, after the case is unsealed and out in the public, and you all are going forward with the case, kind of what happened next in your case?
So it's hard for me to really go back and think of directly what was happening at that time. I think it took a lot of people by surprise, because prior to that coming out, there was quite a bit going on. Like, we had the FDLE that did their investigation, and I was communicating with them pretty regularly. They had the Florida Department of Health investigators that I was talking to pretty regularly. And then I was, I ended up having to go through a lawsuit where the county commissioner had encouraged one of the medics that I reported to the Department of Health to sue me. So I was going through that lawsuit and going through all these depositions and going through more questions. It was very difficult to even get my job done at the time. And I was to the point of almost pure exhaustion and being completely worn out. I think it was called, I think I mentioned to Darth and Jonathan a few times, I'm like, I just want to walk out on a constructive discharge. How do I do this? What do I need to do? Like, I can't do this anymore. I can't. It was to the point where I could barely function. And so that is when it was, I guess, everything became exposed. And I know that at the time, the county administrator, Miss Gilly, was also now undergoing retaliation, as well as the new HR director, where they fired Miss Gilly, then they fired the HR director. But that's because they would not support the fact that the commissioner was claiming I was harassing this individual and that I took away his due process rights, which I did not do. I was like, that was absolutely ridiculous that they even tried to claim that I was just restricting clinical privileges, making sure that he wasn't able to cause harm to individuals in the community. So I was like, there's a big difference when you restrict clinical privileges. I was like, I don't care how much you pay him. I don't care how often he works. He's just going to be able to work at a basic level until he has had the thorough investigation cleared by the Department of Health. And that's where a lot of stuff was happening at the time. But to advance forward, when everything came out, that now this wasn't under seal, it was almost like a breath of fresh air. And I know a lot of people were like, well, that was very smart on your behalf. And I guess it was like, the timeline of events is just kind of scrambled, to be honest. But I know it was all around that same time after Miss Gilly got fired. They had ended up telling me that they were going to contract with some other medical directors, and that they still had to get it approved by the commissioners, but they would probably not need me much longer. And I was just done at that point. I was like, well, if you don't need me, you don't need my license. I'm taking leave. I'm worn out. I was like, I mean, the anxiety, the panic attacks, the tears that I had cried, through the nights. I mean, the stuff that I was getting, like text messages and Facebook messages that were coming through, even though I was blocking them, were just to the point where I could not read it anymore. And that's when I ended up taking the FMLA.
And so when you were out on FMLA, that's actually when you were terminated, right?
Yes, that's correct.
Yeah, this was a uniquely strange part of this case because Dr. Adler went out on FMLA leave after the case was unsealed. So everybody at the county, like, they knew that she was the whistleblower, and her FMLA documents essentially said, "I'm going out on FMLA leave because of the retaliation, because of the physical effects of the retaliation." Um, and we were writing their lawyers letters amplifying and pointing these facts out, and then she started getting like communication back from the county, certainly as her leave was ending, that it sounded like they were going to basically fire her at the end of her leave. And before that, they seemed to be relying on her medical license to operate EMS, even though she wasn't there, she wasn't working, she was out on leave, and they didn't have anybody else. So we're writing them letters, like pointing these things out, like you need someone else with a medical license, like you can't rely on her when she's on a leave. She's on a leave because you retaliated against her. And then at the end of her leave, when they were functionally firing her, and the justification they gave is something like they were eliminating her position, like her job didn't exist anymore. So this is a legitimate reason to get rid of someone coming off of FMLA leave, if like for totally independent reasons the job doesn't exist anymore. But there's a statute in Florida that creates this job, and it's a required job. And so we're writing them letters saying, are you sure you want to do this? I mean, that's not going to be good for your case. And they just kept plowing ahead, which is very strange, a little bit surreal.
Yeah, absolutely. Um, and then, Dr. Edler, can you talk a little bit more about, in addition to all this, public shaming of you they're basically doing, again, there's multiple, actual lawsuits being filed against you, including one of these paramedics that you have been basically trying to keep them from doing a bad job, so restricting the work that they could do until they were being trained properly, essentially. And then they brought suit against you. Can you talk a little bit more about that case and how that case ended up?
Yes, and to like, and just to kind of reiterate too, it wasn't just that case, because the case that I had that was going on against that political operative was also happening. So, they were trying to determine whether I was a public official, a limited public official. So we had to put that to the side. And then, as far as the case with the paramedic, this was an individual who I was very concerned about. I'd brought to county, I'm sorry, not county, it was to the Public Safety Administration a few times, very concerned about behavior that had been reported, and then reports that I was seeing about this individual operating pretty much outside of his scope of medicine. So he would do what he wanted to do whenever he wanted to do it and didn't follow protocol, and really couldn't give a good justification of why he was pushing so many medications, for instance, that shouldn't be pushed in certain instances, and he wasn't following the policies and procedures. But, and I hate to use this term, but when you are part of a good old boy system, some people just are not held accountable as where other people may be held way more accountable. And in this situation, this individual was definitely part of the good old boy clique, and he went to a county commissioner directly and was continuing to talk with him. And so after I had finally did what was called a quality assurance review that was protected, that meaning that that is something that you're not supposed to bring into lawsuits. You're supposed to be protected from any kind of discovery with quality assurance reviews. And this came about from I found out more information about this in particular individual from doing a quality assurance review with one of the other medics, who exposed some more harmful behavior that I was very concerned about. And I knew throughout the course of time that I had been there that he wasn't being held accountable. So that's when I said, okay, I'm going to have to just report this to the Department of Health because nothing's getting done. And so I did. I wrote up my complaints to the Department of Health, and when they found out that this got written and sent over to the Department of Health, which, by the way, I was encouraged, or they tried to encourage me not to submit this letter. That came from county administration, the public safety director. They were threatening me, telling me that it seemed retaliatory because this individual was complaining about me. Well, the reason that they were saying that is because when I filed my first formal complaint to the Department of Health regarding the administration as a whole within public safety, certain names were listed. And what I was told was time and transparency is of essence. So this was all supposed to be kept highly confidential. It is when our internal investigator found our case to be subordinate to any other investigations. And that's when they said, we're going to turn this over to the state. Let's keep it quiet. And my letter leaked to the media. So when my letter got leaked to the media and it got exposed, certain individuals knew that they were under the gun. And those individuals, being part of that good old boy system that I was talking about, all kind of started to pack together and come after me as one. Well, this one individual paramedic that I was telling you about had just a case load of things that I was very concerned about. And so I had to submit another document to the Department of Health. And that's why they were trying to tell me that it seemed retaliatory, because of, I guess what they were saying was that him being on social media saying that I was a terrible medical director and so forth. That's why I guess they thought that I was retaliating against them when the evidence and the documents were all there. When we went to a public forum, that's when Commissioner Burgash had proposed that this medic be able to stand in front of everybody in this forum and just tell his case. And I was like, what is he doing? Like, I didn't know anything about this. I'd never talked to this commissioner. I was like, and that's when they said, well, if we don't, she's starting to violate this individual's due process rights because she's saying that he can't work. Well, that's not what I said. What I said is that I'm restricting your clinical privileges. So instead of being able to push the medications that you can push at a paramedic level or do invasive procedures, you can work at the basic life support level, which means you can help assist with like driving the unit and doing CPR, basic CPR, but you're not going to do anything invasive or make those medical decisions. I don't have any administrative authority, so I could not say, okay, you have to cut his pay or you have to cut his time. None of that was done. So this commissioner kept encouraging, saying that, we're going to get sued, we're going to get sued. And when the other commissioners did not allow him to speak at this public forum, that is when that is when they took a break and they came back, and that's when he said, well, I just found out we're getting sued. He ended up using the same lawyer that that political operative was using, so they both had the same lawyer that was now coming after me in legal matters, and now he was trying to claim that I violated his due process rights and that I was harassing him. So that's kind of where we spiraled from that point forward. And then as that case progressed forward, the Department of Health was doing their investigation. And when we came to the final discussion, I guess, for settlement options, and that's when they found out that yes, he was found to have like 8 counts of probable cause by the Department of Health. And despite the county knowing that, they still agreed to settle for $200,000, which to me was it was a slap in the face, because I was like, we proposed, training for a year that could train like all the individuals through public safety, from the fire department through EMS, and we got that training for a full year for less than 150,000. But you just settled and gave $200,000 to an individual who has 8 counts of probable cause for harm in this community. It was just crazy.
And during discovery in the Ketam, we got witness statements and testimony that it was a county commissioner who had found and possibly even paid the retainer for the lawyer to sue the county and sue and a county employee. It's just, again, very, very surreal facts in this case.
Yeah.
And then for the same person who instigates the lawsuit to vote on the other side of the lawsuit to pay the settlement. Just unusual things that don't normally happen in litigation.
Yeah, and I think speaking of that, there were some interesting legal things that were happening in this case as well. Darth, you want to talk a little bit about that?
Uh, you mean the text messages?
Yeah.
So there, so early on in the case, in discovery, we had asked for a bunch of materials, communications, which is pretty common in like every kind of case. You ask for like all the communications between the various parties. Um, and the county wasn't providing very much of anything that we asked for, frankly. But at some point in the recent past, this same county commissioner had gotten the county IT department to dump a, some or all of his phone, and preserve his phone, which includes text messages. And somebody at the county internally leaked a thumb drive of these text messages to another county employee, and that, I guess, the second county employee in this chain um, was somebody that we were talking to get, firsthand testimony about the facts of the Ketam, and that person sent us the text message file that he had been anonymously given. And sure enough, a bunch of the messages in this very long set of like phone dump related to our case, related to the situations with Dr. Edler and this commissioner's animosity towards Dr. Edler. We of course told the other side, like, we have this file of information that you refuse to give us. We don't know what's on it. Like, it's this person's personal cell phone. There might, if he was talking to his personal lawyer, if he was talking to you, the county's lawyers, we shouldn't have those. Would you like an opportunity to like screen some of that out? And that kicked off many, 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 many months of fighting with the county to figure out like, well, which portions of the text messages are relevant to our case can we use, which ones aren't? Are there sunshine law violations here? Are there other things? At sometime during this mess, and some other anonymous person gave a copy of what seems like the same set of text messages to the local newspaper that started writing a bunch of articles about the contents of the text messages. There were, I think, 3 criminal investigations that stemmed out of the release of the text messages. 2 about like what happened, how did the text messages get out of the county, and I think 1 about the county commissioner and the things that he was saying on the text messages that exposed him to potential criminal liability, and others. Just an absolute mess, and it's kind of a sideshow for our case, but there was information there that was relevant to our case. Um, the county eventually, separate from our case, filed a slap lawsuit against the person who gave us the text messages, against the newspaper that was writing articles, and against some random citizen who had like made comments on Facebook about the text messages. That case is, I think it's finally wrapped up. Like the county's case was dismissed as a slap lawsuit, which is a strategic lawsuit against public participation, basically a First Amendment violation by the county, which is what the local judge said. And the county is now on the hook to pay the, those people and the newspapers like legal fees in that lawsuit. Just lots of fallout from something. I mean, if you start adding up, even without our case, if you add up the time and expense and the settlements that the county's paying out for all these ancillary cases, not even our key tam, it they're all seemingly more than what it would have, as Dr. Eller said, what it would have cost to just do the right training. And then you also would have had properly trained people. And instead, they went forward with many years of not having properly trained people, and then still having to deal with our case.
Um, all right, so Dr. Edler, so you got to the end of the key tam case, and there was a settlement, a civil settlement, in your case, but as a result of the complaints that you were making, there were also some arrests made down there as well, right?
Yes, that's correct.
And there's the money that your case brought back to the government, the criminal arrests, and also you really caused change in the behavior of the EMS in the county as well, and the training that is taking place.
Yes. I mean, I feel like that people are much more aware of how important the training is and how necessary it is. Um, I still, even though I wasn't working with the agency any longer, the medics and EMTs would still come to me. They still felt comfortable coming to me, asking me questions, So, and that's one of the things I strongly encouraged was to make sure that they felt comfortable with the physicians they were working with, so they could get the proper feedback and the appropriate feedback that they needed, so that they could better their skills and better their knowledge.
And are there things that you reflect on that really stick with you from any particular cases or anything like that that you wish that had someone listened to you earlier, maybe you could have prevented anything from those types of things from happening?
Yes. I mean, for instance, the NAS shooting sticks out in my head quite a bit. And there were a few other cases. I always say, we're not God. If it's your time to go, it's your time to go. And I strongly believe that. But I do believe that we're blessed with the knowledge and the tools that if it's not, we can be there to assist. And there were some particular cases. I know that the NAS shooting could have been handled a lot differently, with how, even when you refer back to the transport of the individuals who did come to the hospital, I happened to be the physician that was on call that morning, and I've been working with the Escambia County SWAT team. So the only way I was made aware that there was any major incident involving a mass shooting was because of the information that I was getting from the SWAT team at the time. So at that time, because the retaliation was so bad, they weren't even informing me as the medical director that we had this mass casualty event that was taking place. Um, thank goodness that I was part of the SWAT team at the time, because that's when I looked at our unit coordinator and I was like, I need every trauma surgeon, anybody available to get down to the emergency department immediately. Um, Out of the individuals that were transported to the hospital, of the 7 of them that we did evaluate, only 1 was transported by Escambia EMS, and that patient ended up dying. And so there's a lot more that goes into the discussion of that I'd prefer not to talk about, during the interview. And there were some other cases where time and knowing when to transport these individuals and knowing, how to prioritize, the calls that come in through dispatch, it's critical. And that was a big problem.
Well, I mean, I think it's thinking about those cases not taking place now because of what you've done should give you some sense of, what you did really made a difference, not just in the money that you've brought back for the government, and not just in, the criminal arrests that have been made, but you've really changed the atmosphere there, and you're saving patients' lives, and we really salute you for that. So thank you for everything you've done, and having been through all the retaliation that you've suffered, but knowing that you really have done the right thing at the end of the day, would you do it again?
Absolutely. I mean, exactly what you said. Knowing that I did the right thing is what gives me that peace of mind, when all is said and done. And yeah, I would encourage anybody when they know that people are being harmed or if there's corruption that they should speak up. They should speak forward, because that's what kind of provides the security that we need, knowing that we have protections that are in place for us, whether it's in healthcare or any other kind of employment.
Well, thank you, Dr. Edler, for everything you've done. Again, thank you, Darth, for joining us today. And thank you all for joining us on Fraud in America. I'm Jackie DeMar. Thank you to Getnick Law for being our sponsor. Thank you all again.
Thank you. My pleasure.
Our 2024 sponsor is Getnick Law, a boutique Manhattan law firm dedicated to fighting fraud and promoting business integrity. Learn more about the firm at www.getnicklaw.com. If you believe you've witnessed fraud against the government or on the financial markets, or want to learn more about the laws that exist to fight fraud, visit taf.org, where you can find a directory of whistleblower attorneys who work across the country. On our website, you can find information about the nation's whistleblower laws and programs, and a way to donate to our organization as we continue to fight attacks on whistleblowers and these laws. Fraud in America is presented by the Anti-Fraud Coalition. Jacqueline DeMar is our host. James King is our executive producer. The website for Fraud in America was designed by Wide Eye Creative. Our artwork is by PPA Agency. And our theme song is by Spatial Relations.